So today's topic is assisted reproductive technologies. This is one of the important topics in biotechnology which you have to study well. So coming to assisted reproductive technology.
సార్ వాయిస్ స్లోగా ఉంది సార్.
నేను స్లోగా మాట్లాడుతున్నాను. Okay. So coming to assisted reproductive technology. Is it clear now? Is my voice
Yes,
clear
sir.
now? Okay, good.
Yes, sir.
So assisted reproductive technology includes fertility treatment in which both eggs and sperms are handled in the laboratory. So this is generally speaking, for those couples who are not able to conceive and they can be not called as sterile, rather than they can be called as infertile. Okay, so the process is assisting the normal reproductive process. It assists
సార్
the ఏమా
సరిగ్గా వినిపించట్లేదు సార్.
ఇంతకుముందు నువ్వే అంటున్నావు, మిగతా వాళ్ళందరూ వినపడుతుందని అంటున్నారు.
నేను ఇప్పుడే అన్నాను సార్.
ఎవరికి వినపట్లేదా? ఇక్కడ నెట్ రావట్లేదు. నెట్ రావట్లేదు. ఎవరికి వినపట్లేదా? ఎవరో మాట్లాడండి రా, ఎవరో ఒకరు.
వినిపిస్తుంది సార్.
నీకు వినిపిస్తుంది సార్. మిగతా అందరికీ వినిపిస్తుంది. షర్మిల, నీ దగ్గర నెట్ సరిగ్గా స్లోగా ఉన్నట్టుంది. ఇయర్ ఫోన్స్ తీసుకొని చెవిలో పెట్టుకో, సరేనా? ఓకే.
ఓకే సార్.
సో మనకి ఎవరికైతే జనరల్ గా పిల్లలు పుట్టట్లేదో వాళ్ళకి ఇది అసిస్టెన్స్ గా ఉపయోగపడుతుంది. In addition to this, recently I have seen one movie, Mr. Shetty, Mrs. Poli Shetty, one movie where also this technology is the only topic for the entire film. And about 20 years back, there is a movie called as 9 months, 9 నెలలు తెలుగులో సౌందర్య అనే హీరోయిన్ నటించింది. That talks about surrogacy. So that is also one form of assisted reproductive technology only. యాక్చువల్గా ఏం చేస్తారు అని అంటే, కొంతమంది పిల్లలు పుట్టరు. దానికి అర్థం మేల్ స్టెరైల్ అని కాదు, ఫీమేల్ స్టెరైల్ అని కాదు. అంటే పిల్లకి పుట్టుకోవడానికి కారణం కంప్లీట్గా క్రోమోజోమల్ కాదు. ఏమవుతుందంట, సమ్ టైమ్స్ ద అమౌంట్ ఆఫ్ హార్మోన్ is not sufficiently released so that neither spermatogenesis nor oogenesis will take place. Or we can call this as hormonal imbalance, which may lead to not sterility but infertility. In some cases, into the female reproductive tract, when the sperms are introduced, the female may treat this as an antigen so that against this antigen, that is sperms, antibodies are produced so that there is no fertilization at all. So everything is normal, but there is a discrepancy towards the female side. In such a case also, what happens? There is no conception. The couples cannot give birth. In such cases, these methods assist the normal reproductive method. Hence, we call it as assistive reproductive methods or technologies. In short, ARTs, assisted reproductive technologies. Okay, and for this you have to know familiar with certain terms which you will be coming across with throughout this presentation. One is in vitro, the other is in vivo. When we hear in vitro, you have to think that it is lab based, something that is done in test tubes or other laboratory equipment. In vivo means something that is done in the animal itself. సో మనం ఈ ప్రజెంటేషన్ మొత్తంలో అప్పుడప్పుడు ఈ రెండు పదాలు వింటూ ఉంటాం. ఇన్ విట్రో ఒకటి, ఇన్ వైవో ఒకటి. ఇన్ విట్రో అంటే ల్యాబ్లో చేసేటటువంటి ప్రయోగం. అది పరీక్షణాలికల్ టెస్ట్ ట్యూబ్స్ని ఉపయోగించేసి ఇంకేదైనా పరికరాలు. అలా కాకుండా ప్రయోగాన్ని డైరెక్ట్గా యానిమల్లోనే చేసామనుకోండి, లేదా హ్యూమన్ బీయింగ్లోనే చేసామనుకోండి, దాన్ని ఇన్ వైవో అంటాం. నెక్స్ట్ ఇంకేం టర్మ్స్ వస్తూ ఉంటాయి అని అంటే, దానికి ముందు మనం ఒకసారి ఫీమేల్ రిప్రొడక్టివ్ సిస్టమ్కి సంబంధించి కొన్ని పదాలు మీకు చెప్తాను. ఫస్ట్ వన్ ఈస్ ఓవరీ. దిస్ ఈస్ నథింగ్ బట్ ఓవరీ అంటే ఎవరైనా చెప్తారేమన్నా?
Female reproductive organ, sir.
This is the female gonad. Ovary produces ovum, which is also called as egg, and the plural of ovum is ova. ఓవరీలో మనకి ఓవం అండ్ కణాలు లేదా ఎగ్స్ ప్రొడ్యూస్ అవుతాయి. ఈ రెండు పదాలు గుర్తుంచుకోండి. ది ఎంటైర్ ప్రాసెస్ ఆఫ్ డెవలప్మెంట్ ఆఫ్ ఓవం ఈస్ కాల్డ్ యాజ్ oogenesis. ఎగ్ డెవలప్మెంట్ అంతటినీ కలిపి మనం ఏమంటాం? oogenesis అంటాం. oogenesis ఎక్కడ జరుగుతుంది? ఇట్ టేక్స్ ప్లేస్ ఇన్ ద ఓవరీ. ఓవరీలో జరుగుతుంది. సో ది అవుటర్ లేయర్ ఆఫ్ ovary is called as germinal epithelium. చుట్టూ ఉన్న ఈ లేయర్ ఏమన్నాం మనం? germinal epithelium అన్నాం. And from this develops, due to a number of mitotic divisions, a group of cells. This is called as primordial follicle, which undergoes series of divisions and formation of layers and forms into another structure where the cells are organized into layers. And this structure is called as Graafian follicle. Graafian follicle. And inside the Graafian follicle, under the influence of pituitary gland, this is the pituitary gland, which secretes follicle stimulating hormone. Under the influence of this hormone, which induces the ovary in such a way that out of all these cells, only one develops and forms into ovum. రెండిట్లోకి ఒక్కటే ఓవంగా డెవలప్ అవుతుంది. If follicle stimulating hormone is not secreted, oogenesis will not take place. Okay. Next, after the ovum is developed, what happens? The ovum breaks open. It breaks this is the entire layer. Just a second. So this is the outermost layer, and this is the terminal epithelium. Okay. After the ovum develops, what happens is it breaks the ovary, this side, and also the Graafian follicle, and ovum is released outside. And the release of ovum is called as ovulation. So this you have to remember. Release of ovum from ovary is called as ovulation. After ovulation takes place, then only it may lead to fertilization. Okay. So this is ovary, where the germinal epithelial cells divide to form primordial follicle, which matures to form Graafian follicle, in which under the influence of follicle stimulating hormone, oogenesis takes place and only one ovum develops. And after the development of ovum during oogenesis, ovum comes out of the graphene follicle by rupturing it and releases into the body cavity, and this process is called as ovulation. Ovulation. మరి ఈ ప్రాసెస్ అంతా జరిగిన తర్వాత ఓకేనా మనకి సైంటిస్ట్ ఒక చిన్న ప్రయోగం చేశారు. వై ఓన్లీ వన్ ఓవమ్ ఈస్ గెట్టింగ్ డెవలప్డ్ out of so many graphene follicle cells? There are hundreds of these cells. How come only one ovum develops? So they wanted to know what is the reason. So they could know that it is FSH that is responsible for stimulating the ovum. Now they wanted to see if the concentration or the titer value of FSH, if it increases, whether multiple ova are going to be released or not. So previously, let us say 1 nanomole of follicle stimulating hormone is released. Now they have doubled it to 2 nanomoles and introduced it into the ovary. Now what happened is, instead of one ovum, multiple ova are produced and multiple ova are said to be ovulated. Okay, so release of more ova can take place when you use what we call extra quantity of the reproductive hormones like follicle stimulating hormone. Next, what happens after the ovulation? For this, you have to know the structure of the female reproductive tract. So, the female reproductive tract is like this. Okay, so here there is a female genital opening, and this female genital opening leads into another place called as cervix. The cervix leads into uterus. Okay, female genital organ, cervix, followed by uterus. Uterus leads into fallopian tube. Fallopian tube is called as oviduct. Fallopian tube is called as oviduct. It opens out through an opening called as ostium. It opens out through an opening called as ostium. And attached to the ostium, here the ovary is present. The ovary is present here. So inside the ovary we have seen there are graphene follicles. From the graphene follicles, what happens? Ovum is released, isn't it? So only one ovum is released. Though there are two ovaries, only one ovum is released. And this ovum now is taken up by the ostium into the fallopian tube. Next, female genital organ is the region through which the sperms are released into the female reproductive tract, and they migrate along with the semen and reach where the fallopian tube. After reaching the fallopian tube, what happens here? Fertilization takes place and zygote is formed. After fertilization is over, all the sperms are said to be disintegrated. Now, the zygote starts cleavage. It results in 2 cell stage, followed by 4 cell stage, followed by 8 cell stage, and ultimately it results in the formation of a small embryo called as morula, followed by blastula, followed by gastrula. And this develops into a small baby, which we call it as fetus. And the development of the fetus from embryo requires food material, and for which between the wall of the uterus and the wall of the fetus, they develops a connection, and this connection is called as placenta. Okay, and for the placenta to develop, what happens? The fetus goes into the wall of the uterus, inside which it is said to be lodged. Okay, so the entire development takes place within the wall of the uterus, and the process of embedding of the developing embryo into the wall of uterus is called as implantation. So, after implantation, takes place, placenta develops, and the growth of the baby takes place. After the growth of the baby takes place, the baby gets delivered at the end through the female genital organ. So these things you have to remember. Okay, and there is process developed where, because the baby is coming through this route, why not the embryo, if the individual is not able to develop the ova, or if the individual is not able to develop the sperms, they do artificially in laboratory the process of fertilization, where the sperms and ova from the donors and recipients are fertilized and zygote is formed. And the zygote is allowed to cleave and allowed to undergo cleavage to produce an embryo. Now this embryo is transferred into the uterus, where again implantation followed by placentation takes place and the development of the baby takes place. And there are certain individuals where the uterus is very weak. The uterus is very weak and she cannot bear the weight of the growing baby. In such cases, these mothers cannot carry the embryo. So what they do is, there is a male and there is a female. He donates sperms and she gives ova, and fertilization takes place resulting in zygote. Zygote develops into embryo, and this embryo cannot be taken into the same mother because her uterus is somewhat weak. So what happens? They take the assistance of another female, where they introduce this uterus into this embryo into her uterus, and where the development of the baby takes place. After this, the delivery of the baby takes place, and the baby is given to its parents. And in such case, this female is called as surrogate mother, and the process as surrogacy. Surrogacy. So surrogacy means, she somewhat, her womb, her uterus is taken for rent. We can call this as, they call this as scientists as. Okay, so she conceives, sorry, not conceives. She bears the embryo, allows the baby to grow. After that, she gives the baby to its original parents, and neither these parents nor this mother know each other. Unless otherwise, if she knows after delivering baby, she may not give the baby to them. So many of the clinics do this, where the identity is not disclosed at all. In certain cases, there is a male, there is a female. Female releases only one ovum, but male releases millions of sperms. For example, 1 ml contains 1.5 million of sperms, and this is the requirement to fertilize one ovum. There are certain males where the amount of sperms is very less. For example, let us say 1 million or zero point 0.5 million or 0.25 million. In such a case, those sperms are produced here. This individual, though he introduces the sperms into the female reproductive tract, it will not fertilize, because to fertilize one ovum, this is the quantity that is required. And in such cases, what the doctors do is they give certain injections so that the glands produce more sperms. Okay. In certain cases, the male is normal and the female is not able to produce ova. So in both the cases, when injections fail and when or even after injection he is not able to develop the required count of sperms, or if the female is not able to produce ova, they go for donors. They go for donors. So there is a male who donates the sperms, and this is the female, and he is the husband. Okay, and the ova of this female may be fertilized with this one, and the embryo is transferred into this female, and she conceives, for which the husband agrees. Or the ova of one female is not produced, then from female the ova are collected, and these are fertilized with the sperms of this individual, so that after this they are introduced into the reproductive tract of the mother of this lady or into a surrogate mother. In certain cases, where both male and female are not able to produce gametes, only from donors they are taken. So, male donor gives sperms and female donor gives ova. Both are fertilized. Both are fertilized, and they result in zygote, that is either introduced into this female or into a surrogate mother, and after the development of the baby, and that baby is given to them, and these two donors never know this, and these two parents never know these individuals. So what this process actually is, it is just assisting the normal reproductive process, so that those couples who cannot give birth to their children can take the help of this technology. And it is against the traditions in some countries, against the culture in some countries, and for the first time when it was introduced, it was not at all accepted by many of the countries. But later, the parents agreed, the couples agreed, we want a baby in this manner, we want a baby of our own in this manner. So, recently, not recently, a number of babies are said to be being born by these technologies. And one girl that is called as Louis Brown is the first baby that is born on Earth due to assisted reproductive technology, due to in vitro method using test tubes, and hence she is called as the first test tube baby, and she is normal and live normal for so many years. So this is the introduction. Any doubts up to this point, please ask me, otherwise I'll move to the remaining topics. Emma, go చెప్పిన అర్థమైందా? సూర్య ఏమైనా డౌట్ ఉందా?
No, sir.
Okay. Coming to the first topic, that is artificial insemination. Insemination means, semen means the fluid which contains sperms. Okay. So introduction of spermatic fluid is called as artificial insemination. It is done artificially with the help of certain instruments, not by normal male female intercourse. And coming to the artificial insemination, it is the deliberate introduction of sperm into a female's cervix. I told you what these terms are previously, or uterus cavity, or even into fallopian tube, for the purpose of achieving pregnancy through in vivo fertilization. In vivo means the fertilization is done in the female itself. That means the female released the ova, and now the sperms are artificially introduced, and this fertilization takes place in the female, in the organism itself, hence it is called as in vivo fertilization. So this is opposite to the normal sexual intercourse where the male introduces the sperms. Here the artificially it is introduced, and it is a sort of fertility treatment for humans, but also before doing this in humans, it is done in a number of animals, and this process is called as animal breeding technology, and it is also done in zoo animals. For example, where there is a tiger, this population, the tiger's population due to hunting has decreased, and tigers are said to be not going to be there on the face of the earth. So we cannot do this. We cannot make certain animals extinct. So by doing this technology, we can increase the population of other animals also. Or even by employing such techniques, we can give rise to certain hybrids also, that are high yielding varieties which can give high yields of milk and what we call um, beef, pork, etc. etc. Okay. Next, here there is a biological mother, and this biological mother can accept the sperms from the husband artificially, or from a relative artificially, or from a sperm donor artificially. And the first artificial insemination is done in dog by Italian scientist Lazzaro Spallanzani in 1780 itself. It dates back to three centuries before. In humans, it is done by John Hunter in 1790. And the first artificially, for the first human being who donated his sperms for this process is done by Dr. William H. Pancoast. And after this, what the science, what the clinics are doing, these clinics are collecting semen from different donors, and they are storing them in what we call liquid nitrogen under 175 degrees centigrade, where they can be stored for millions of years. Okay, and these are called as sperm banks. Sperm banks. It is opened in a city called Iowa by Sherman and Bunn. And the first fertility clinic was opened in United Kingdom in 1930s. And this lady doctor, Mary Barton, used her husband's semen, where he fathered about 1,000 babies. Next, who needs artificial insemination technology? Where the fallopian tubes are said to be not closed, they are open, then fertilization will not take place. Where the cervical factor, where what happens? The cervix is the place where the sperms are introduced. If the cervix is blocked by mucus or it is said to be scarred, the sperms cannot enter the fallopian tube through the cervix. And there are certain ovulatory abnormalities like irregular menstrual cycles or even polycystic ovary syndrome, PCOS also may lead to what we call uh, the non-development of the ovum, oogenesis, so that they also need artificial insemination. But there are certain uh, medications being developed for PCOS. So even though a girl is having PCOS, she can go to the doctor and can reduce this. Get she can get operated or any other thing. She can use medicines and she can be normal. Only when all these things fail, then only she will go to artificial insemination. Coming to male, here the male is unable to inseminate. That means required quantity of sperms are said to be not released into the female reproductive tract. There are certain males who are normal completely, but the semen is not having sperms at all. This condition is called as euageospermia, and those males also said to be have to be going to conceive to give a chance for his for his wife to give birth to the young ones. They can go for artificial insemination. So coming to the steps involved in this process, the first step is the physical examination. Both the couples are examined thoroughly, completely. Okay, and there are certain technologies used, hysterosalping, salpingography, where the female entire reproductive tract is actively scanned and the blood testing is done, sperm count analysis is also done. All these come under physical examination. And after that, the second step is fertility drugs and monitoring. If the male is not able to provide enough sperms, and certain injections or medicines are given for inducing the male to produce sperms, or if the female is not able to produce ovaries, she will be given clomid, a medicine or which is equivalent to the gonadotropins before this process. And one such is said to be human chorionic gonadotropin, we call it as HCG, which triggers the process of release of ovum, that is ovulation. And after this is done, insertion of sperm has to take place between 24 to 36 hours after this injection. And this is closely monitored continuously, monthly or bi-monthly or 15 days, fortnightly by blood tests and ultrasounds. And the ovulatory cycles of the female is said to be tracked, and the luteinizing hormone surge in her urine is also tested. Okay, once the luteinizing hormone surge takes place, one or two artificial insemination procedures in each cycle is said to be done. And coming to the third step, it is the process related to milk. So sperm sample is taken, it is washed thoroughly with buffers, and it is processed. If unwashed semen is used, it may result in uterine cramping. That means the uterus may undergo cramps. The muscles may contract and they will not allow the embryo to develop. And before that, what happens is if uterine cramp takes place, the sperm that is introduced will be expelled even. The semen is expelled. So in order to avoid this, the semen has to be washed thoroughly. Okay, and the donor sperm can be quarantined at least for it can be 6 months. And the washing of the sperm has several benefits. The sperms are concentrated to boost the chances of getting pregnant. Why the concentration has to take place? Because the quantity of sperms per each ml should be optimum. Okay, this is just an example. Next, it may prevent female partner allergic response to the sperm. That is what we have discussed. It may help to minimize any uterine cramping. So this is what is required. That is, sperm washing is said to be, semen washing is said to be required. And after this, the actual process of artificial insemination, where insertion of the semen takes place. It is quick and usually painless for the woman. When the procedure begins, female partner will lie down for a pelvic exam. After that, a speculum, it is a small spatula-like thing, is inserted. That the sperms are placed all the way into the directly into the uterine cavity with a thin catheter and syringe. And after this, the female is allowed to take some rest. After the 8th procedure, a cervical kappa sponge is placed and she will allowed to lie down for 15 to 20 minutes so that the sperms reach the fallopian tube. To help this process more relaxing, she may want to bring a partner or a close friend or a book, whatever helps her to relax. If she is still unable to get pregnant after several such cycles, the doctor may want to do further fertility testing. Okay, so this is the speculum that is used, this is the catheter that is used. Okay, so with the help of the speculum, it is kept open. With the help of the catheter, the sperms are introduced into the female reproductive tract. And there are different types of artificial insemination. While writing the examination of this topic, if it is given an essay, you have to write down all these processes. If it is given in short notes, you just have to write down the steps of the procedure and just one sentence for each of these. So coming to the first one, intracervical insemination. That means these are inserted into the cervix. Second one, intrauterine insemination. The sperms are introduced into the uterus. The third one is intrauterine tuboperitoneal insemination. That means it is released from the uterus through the into the fallopian tube directly. It is intratubal insemination where it is introduced into the fallopian tube directly. So the short abbreviations are ICI, IUI, IUTPI, and ITI. If you can't remember these terms, at least remember these abbreviations. You can remember these abbreviations easily. Okay. And coming to the advantages of artificial intelligence. One, it controls diseases because when the doctors take the sperms, they trace down the genetic history of the individual and even they check the genome of the sperm so that there is no trace of any genetic disorder in the particular person. So disease can be controlled. Semen can be collected from the desired persons in the case of donor sperm. Semen is evaluated each time it is collected. Every time it is evaluated. And some females are having sperm allergy so that after copulation has taken place, the sperms are not reaching the fallopian tube. So because now in this process sperms are washed thoroughly, this sperm allergy, that means the sperms of this husband only is taken and it is washed thoroughly so that the female's allergy is said to be lost and fertilization will take place. And several issues like impotency, that means sterility, male infertility, low sperm count issues, all can be addressed by this. And the disadvantages is it is highly expensive, not normal people can afford this, and an individual with technicalities and expertise need. If it is incorrectly practiced, it may result in hormonal imbalance, internal bleeding, and causing serious problems to the female. Okay, these are the various processes involved in artificial insemination. The second artificial reproductive technology is in vitro fertilization. Are you there? ఉన్నారా లైన్లో అయిపోయారా?
Yes, sir. Yes, sir.
Okay, good. I'll close in 20 minutes or 15 minutes. In vitro fertilization. During in vitro fertilization, mature eggs are collected from the ovaries and fertilize them with sperm cells in the laboratory. That is why we call it as in vitro. Previously, artificial insemination is done within the human being, within the female. Now it is done in the laboratory. Hence, we call it as in vitro fertilization. The fertilized eggs or embryos are then transferred into the female uterus, and this full cycle of in vitro fertilization technology takes 3 weeks, and it is the most effective form of assisted reproductive technology. And here, the surrogate mother is said to be used. And who donates and who receives, the same is the case as in the case of artificial insemination. And coming to the preparation for IVF, before starting the IVF cycle using own eggs and sperms, couples will need various screenings. Why own eggs and sperms are used? Because they're able to produce eggs. The female is able to produce egg. The male is able to produce sperms, but the female is having sperm allergy, so she cannot conceive. Or the sperm count is not sufficient here. So in both the cases they require. So they need not take from other individuals, rather they can take their own eggs and sperms. So first is storage testing in ovary. To determine the size and quality of the eggs, a technique called as sonohystrography is used, and blood tests are employed to know whether the hormones are in required quantity in the blood or not, like follicle stimulating hormone, estrogen, anti-Mullerian hormone. And after that, semen analysis is done, where required quantity of sperm count is said to be present up there. And infection screening, screening for infections including HIV is done. That means the same sperm has to be screened. The female egg is also has to be screened whether there is HIV infection or not, and other infections also. And it is followed by mock embryo transfer and followed by the train test. And coming to the process, the first stage is said to be ovarian stimulation, followed by collection of eggs, collection of sperm, fertilization, and embryo transfer. And it takes 2 to 3 weeks for the completion of the entire cycle. So, for ovarian stimulation, already I told you, follicle stimulating hormone, if it is given in required quantities, more than required quantities, and in the ovary, multiple ova may develop. So the woman starts treatment with synthetic hormones at the beginning of the cycle, because hormones cannot be collected from normal human beings. No one allows it, and it's not also ethical. And estrogen, follicle stimulating hormone, all these are said to be developed in laboratories. Okay, and these are involved in developing multiple follicles, so that from each follicle one egg develops. From each follicle one egg develops, or multiple eggs also may develop. So several eggs are said to be collected. Why more eggs are collected? Because if they collect only one egg for the entire process of 1, 2, 3, 4 weeks or 6 months or 1 year, if this is not able to be fertilized, it's not what we call helping the sperm to fertilize it, then it's a wasteful process. So many eggs are said to be taken for this process, and there are many different medications required. And there are medicines for stimulating the ovary, medicines for oocyte maturity, like HCG, where the primordial follicles are grown into Graafian follicles where oogenesis takes place, and premature ovulation prevention drugs. Ovulation has to take place only after 14th day of the female menstrual ovarian cycle, and if it takes place before that, that is premature ovulation. And there are drugs to prevent this, and medications to prepare lining of uterus. Why? Because after fertilization has taken place, zygote is formed, it develops into embryo, and embryo has to be implanted here into the uterus. For this, the sorry, embryo has to implant in the uterus. For this, the wall of the uterus undergoes a number of changes where it increases in thickness so that it can carry the developing baby. గర్భాశయం గోడ గనక పలుచగా ఉంటే ఎదుగుతున్న బేబీ గనక దాని బరువుకి ఇది తట్టుకోలేదు. కాబట్టి అందుకని యుటరస్ వాల్ని కూడా ప్రిపేర్ చేయడానికి ప్రొజెస్టిరాన్ తీసుకుంటారు. ఓకే, నెక్స్ట్, టు డిటర్మిన్ వెన్ ద ఎగ్స్ ఆర్ రెడీ టు బి కలెక్టెడ్, ద డాక్టర్ ఈస్ లైక్లీ టు డూ వన్ వెజైనల్ అల్ట్రాసౌండ్ అండ్ బ్లడ్ టెస్ట్. ఈ రెండు చేసి ఓవరీని కలెక్ట్ చేస్తారు. Coming to the collecting eggs, you can call them as oocytes. Why? Because oogonia increase to result in primary oocyte, undergoes meiosis 1, produces secondary oocyte, undergoes meiosis 2, produces ova. So these are called as oocytes. So here the eggs of oocytes are collected. They are retrieved after 34 to 36 hours after the final injection of female sex hormones or other hormones before ovulation. Before the egg is retrieved, she will be given such anesthesia, that means sedatives and pain medications also. And transvaginal ultrasound aspiration is a common retrieval method where through the vagina the ultrasonography instrument is introduced and it is allowed, it is said to be used for the retrieval of the ova. And abdominal ultrasound can be used to guide the needle if the ovaries cannot be obtained through transvaginal ultrasound. If this process is not followed, they can use abdominal ultrasound technology. And coming to the collecting the eggs, this is what the diagram that I have discussed with you earlier. Ultrasound probe is inserted into the vagina to detect the follicles. Then a thin needle passes through the vagina as indicated by the ultrasound and enters the follicles to retrieve the egg. From the follicle, the egg is said to be retrieved. Because the ovary is attached here, it cannot be directly introduced here, for which the stomach has to be dissected. But here, the ultrasound instrument can be passed through this, reaches the ovary, reaches the Krapen follicle, reaches the ovum, and collects the eggs. Okay. Many eggs can be removed from the follicles with the needle attached to the suction device within 20 minutes. After the eggs are retrieved, the woman may feel numbness, feeling of fullness or stress. The mature eggs incubated in a nutrient liquid culture medium. After taking out the retrieving the eggs, they are given the nutrient liquid. They are placed in the nutrient liquid medium. So we have collected the eggs now. Now we have to collect the sperms. If a woman uses the semen of her partner, he collects his sperm sample by the normal process in the doctor's office or clinic. And if it is not possible, epididymis, this is the testis. There are seminiferous tubules where the spermatogenesis takes place, and it leads into epididymis where the sperms are stored. So this epididymis can be punctured and the sperms can be collected directly. And if the husband is not able to produce enough sperms, they can be taken even from the donor. After that, what happens? Artificially in the laboratory, the fertilization process is done. So fertilization can be done using two common methods. One is conventional insemination, that is artificial insemination that we have used, and intracytoplasmic sperm injection. This is another one where directly the sperm is said to be injected into the ovum or egg, for which a holder or pipette is said to be used. While discussing microinjection of DNA, the same process is said to be also we have discussed. In the intracytoplasmic sperm injection, only one healthy sperm cell is directly injected into mature egg, not Thousands of or millions of sperms are not required here. One sperm can be directly injected into the egg where fertilization takes place. For this, the quality or number of sperms is not a big problem at all. In some cases, the doctor may prescribe other procedures before the embryo is transferred. One is assisted hatching. A hole is made in zona pellucida. What is zona pellucida? This is the egg and it is its plasma membrane. Around the plasma membrane, there is another layer called as vitelline membrane in case of other animals. In us, we call it as zona pellucida. So this is an outer egg membrane, primary egg membrane we call it as. So a hole is made in this primary egg membrane so that the sperms can be easily introduced. Okay. And next one is pre-implantation genetic testing, which is also required. And the next one is embryo transplantation. After in the laboratory, in the test tubes, this entire process is done, or even it is introduced into the sperm is said to be directly introduced into the egg, where fertilization takes place and it develops into a zygote. And this zygote is allowed to develop into an embryo, and this embryo is transplanted into the uterus of the female, so the development takes place. And this is done with the help of catheters and other instruments, which we are going to discuss right now after this topic. After the process, certain side effects are there. Swabbing the uterus before the embryo transfer can lead to short secretion of clear or bloody fluid, and breast tenderness due to high estrogen level takes place. Bloating. Bloating means the entire abdomen feels as if it is uh, filled with gas, and certain moderate cramps and constipation also may occur in the female. And there are certain hazards. One is ovarian hyperstimulation syndrome. If you continuously give human gonadotropin, what happens from the ovary? Multiple ovaries are to be produced, or multiple follicles are produced, and it may result in this syndrome where it may lead to certain what we call uh, unwanted problems. For example, the ovaries become swollen and they are very painful for the woman, and the female gets rapid weight gain because she's administered estrogen. Estrogen in normal quantities, no problem. Where every pregnant woman is somewhat healthier than the normal, uh, what we call uh, before marriage, a woman, a bachelor woman. This is because of estrogen. So this estrogen is also used. Progesterone is also used. Follicle stimulating hormone is used. All these sex hormones are used. There is a rapid weight gain, and there are mild abdominal pains, nausea, means uh, vomiting feeling is called as nausea, and vomiting and diarrhea within a week may also occur. These are the hazards for this in vitro fertilization process. It may lead to multiple births and ectopic pregnancy. Ectopic pregnancy means the development of the embryo other than the uterus process, other than the place of uterus. That is called as ectopic pregnancy. If that is happens, it is a complete loss of the or failure of IVF at all, and it causes financial problems, physical problems, even mental problems for the individual. Okay, next, last topic for today is, it will not take more than 5 minutes. Superovulation, embryo transfer, and embryo cloning. Superovulation. Recently, we have seen that we have to collect more number of eggs for the process of what we call this assisted reproductive technology. And collecting more number of eggs or oocytes is called as superovulation or multiple ovulation, done by multiple ovulation or superstimulation. So, superovulation is the method of increasing the number of oocytes that are released in single ovarian cycle or estrous cycle. Okay, and it is also done by stimulation of follicles, and it is also done by stimulating with hormones. For example, let us take the female cow. Normal cycle of a non-pregnant female cow The one for the ovarian follicle out of 20 matures and releases one fertile egg at a time. So there are 20 follicles. Out of these 20 follicles, only one follicle matures, becomes the Graafian follicle, and of this, only one ovum develops. One egg develops at a time. It is the normal course. And the time of ovulation, that means release of ovum from the ovary, is different in different animals. It takes just 21 days for cow and horse, 16 days for sheep and goat, and for us, for human beings in females, it takes 40 days in the estrous cycle or ovarian cycle. And the hormones that are involved in superovulation are mainly follicle stimulating hormone. As I have told you before, if you increase the concentration of SH, more number of follicles mature and more eggs are said to be produced. And recently, prostaglandins 2A also are employed in this process. And coming to the process, first of all, prostaglandin F2A is said to be introduced. After 10 days, follicle stimulating hormone is injected for 4 days. Again, after this, prostaglandin hormone F2A is introduced, and now it starts producing more more follicles, and more oocytes are said to be released, a process called as superovulation. And after superovulation takes place, artificial insemination is done, where fertilization takes place by introducing directly the sperm into the egg. Embryo is formed after 1 day, okay, and 2 cell stage 2 days, 8 cell morula 3 days, blastocyst 4 days, and from this the embryo is transferred into the uterus. Advantages of superovulation: for embryo transfer, it is used for estrous synchronization programs. That means when the ovarian cycle is just to be disturbed, and this process is said to be used to shorten the generation interval by a year or more. Okay, so for example, first baby is born 2024, and it takes the second baby to born in 2025, one year only. But by doing this process, you can decrease it within the same year. You can have two or more babies, and thus the animal population can be increased effectively by this process. In the next topics, after superovulation is done, what we do is embryo transfer. Embryo transfer includes two processes, MO and ET. Multiple ovulation, that means superovulation, followed by embryo transfer. Those are these two are coupled. If there is a question only for superovulation, you have to write embryo transfer also. If there is a question on embryo transfer, you have to write superovulation also. Start with this and end with this. So here the embryos are collected from the donor females and transferred into the uterus of recipient, that is foster mother, which we call it as, in case of human beings, we call them as surrogate mother. In others, they are called as foster mothers. లైన్లో ఉన్నారు అందరూ వెళ్తారా? నాకు మీరు ఉన్నారో లేదు తెలియదు, అప్పుడప్పుడు
ఉన్నాం సార్.
ఉన్నాం సార్.
ఓకే ఓకే, మేము అంటుంటే నాకు తెలుస్తూ ఉంటుంది. ఓకే, అయిపోతుంది, క్లోజింగ్ వస్తాం. సో మేటింగ్ ఆఫ్ యానిమల్స్ న్యాచురలీ ఆర్ by artificial insemination produces limited number of offsprings. అంతే కదా, మామూలుగా నేచురల్ ప్రాసెస్ అయితే సంవత్సరానికి ఒకటే. సో నాకు ఎక్కువ, నా గొర్రెల పాపులేషన్ ఎక్కువ కావాలి, నాకు ఆవుల పాపులేషన్ ఎక్కువ కావాలి, మేకల పాపులేషన్ ఎక్కువ కావాలి, మార్కెట్లో అమ్మేసుకోవచ్చు, లేదా బోల్డ్ పాలు సంపాదించేయచ్చు, ఏదైనా చేయొచ్చు, డబ్బులు ఎక్కువ కావాలంటే ఈ ప్రాసెస్కి వెళ్ళిపోవడం. Embryo transfer will produce a greater number of genetically superior embryos will be produced in a minimum period. సో జెనెటికల్ సుపీరియర్ ఎంబ్రియోస్ ఎందుకంటున్నాం, బాగా పాలిచ్చేటటువంటి, ఓకే, ఫీమేల్ తీసుకున్నాం, బాగా మాంసం ఇచ్చేటటువంటి మటన్ కదా, మేకలు అయితే మేల్ తీసుకున్నాం. దీని ఓవా దీని స్పర్మ్స్ కలెక్ట్ చేసి తయారు చేసాం కాబట్టి మనకి ఏమొస్తుంది, సుపీరియర్ హైబ్రిడ్ తక్కువ పీరియడ్లో కావాల్సినవి ప్రొడ్యూస్ చేసేయచ్చు. ఓకే, so thus it is used in livestock to maximize the genetic potential of elite females in a herd. Elite females అంటే ఒక 100 గొర్రెలు ఉన్నాయనుకోండి, 100 గొర్రెల్లోనూ 10 గొర్రెలు ఎక్కువ పాలు ఇచ్చామనుకోండి, వాటిని లైట్ ఫీమేల్స్ అని అంటారు. ఓకే, స్టెప్స్ ఆఫ్ ఎంబ్రియో ట్రాన్స్ఫర్ తెలిసిందే. కలెక్షన్ ఆఫ్ ఎంబ్రియోస్ ఫ్రమ్ ది సూపర్విలేటెడ్ ఫీమేల్స్ యూజింగ్ క్యాథెటర్ కలెక్షన్ చేసేస్తాం ఇన్సెమినేషన్ చేసిన తర్వాత. ఓకే, తర్వాత ఏం చేస్తాం, 6 to 8 embryos are collected in each flush. ఒకేసారి ఏం చేస్తారట, 6 నుంచి 8 ఎంబ్రియోస్ కలెక్ట్ చేస్తారు. అండ్ క్వాలిటీ ఆఫ్ ది ఎంబ్రియోస్ ఆర్ చెక్. కలెక్ట్ చేసిన తర్వాత ఆ ఎంబ్రియో క్వాలిటీ సరిగ్గా ఉందా లేదా చూస్తారు. లేదనుకోండి అది స్టిల్ బర్త్ అయిపోవచ్చు, లేదా డెవలప్మెంటే కాకపోవచ్చు. తర్వాత ఏం చేస్తారు, ఎంబ్రియో ఇస్ ఇంప్లాంటెడ్ ఇన్ టు ది రెసిపియంట్ అండ్ రిమైనింగ్ కెన్ బి ఫ్రోజన్ అండ్ స్టోర్డ్. సో వీటన్నిటిలో ఒకదాన్ని ఇంప్లాంట్ చేస్తాము, వీటన్నిటిని ఫ్రీజ్ చేసి నెక్స్ట్ ప్రాసెస్ కోసం ఈ ప్రాసెస్ కనుక ఫెయిల్ అయిపోతే ఉపయోగిస్తాం అనమాట. డోనర్ అండ్ రెసిపియంట్ యానిమల్స్ మస్ట్ హ్యావ్ ఎ సింక్రనైజ్డ్ ఈస్టర్ సైకిల్. సో డోనర్ యానిమల్, ఎగ్స్ ఇచ్చే డోనర్ యానిమల్, సర్గేట్ మదర్, ఫాస్టర్ మదర్ ఇద్దరికి కూడా ఈస్టర్ సైకిల్ సింక్రనైజ్ అయి ఉండాలి. లేదనుకోండి ఈస్టర్ సైకిల్ ఏమవుతుందని చెప్పాను మీకు, ఒక పక్కన ఓవరీలో ఓమ్ డెవలప్ అవుతుంటే ఇంకో పక్కన యూట్రస్ వాల్ కూడా డెవలప్ అవుతూ ఉంటుంది. సో ఈ యూట్రస్ వాల్ కూడా డెవలప్ అవ్వాలి. సో నేనేమో ఈ ఫీమేల్ నుంచి ఓవరీ నుంచి కలెక్ట్ చేశాను, దీనిలో యూట్రస్ వాల్ బాగానే డెవలప్ అయింది, కానీ దేంట్లోకి ఇంట్రొడ్యూస్ చేస్తున్నాను, దీంట్లోకి ఇంట్రొడ్యూస్ చేస్తున్నాను, దీనిలో వాల్ బలహీనంగా ఉంది, అప్పుడు ఉపయోగం ఏముంది, ఉపయోగం లేదు. కాబట్టి రెండింటివి కూడా ఈస్టర్ సైకిల్స్ మ్యాచ్ అవ్వాలి, అప్పుడే అవుతుంది ప్రెగ్నెన్సీ. మరి ఇది 100% సక్సెస్ అంటే 50 to 60% ఉంది. సో ఫస్ట్ ఏం చేశారు, సూపర్ ఓవులేషన్ ఆఫ్ డోనర్ విత్ గొనాడోట్రోపిన్స్, followed by artificial insemination, followed by collection of the embryo, నాన్ సర్జికల్ అంటే అక్కడ ఆపరేషన్ ఏం చేయరు, డైరెక్ట్గా రిప్రొడక్టివ్ ట్రాక్ నుంచి కలెక్ట్ చేస్తారు కెప్టర్ యూజ్ చేసి. ఐసోలేషన్ అండ్ క్లాసిఫికేషన్ ఆఫ్ ఎంబ్రియోస్, బర్త్, that is 9 months after embryo transfer, birth takes place. ప్రెగ్నెన్సీ డయాగ్నోసిస్ చేస్తారు, ట్రాన్స్ఫర్ ఆఫ్ ఎంబ్రియోస్ చేస్తారు, అవసరమైతే కనుక ఎంబ్రియోస్ని స్టోర్ చేసుకుంటారు. కమింగ్ టు ది అప్లికేషన్స్ ఆఫ్ ఎంబ్రియో ట్రాన్స్ఫర్, ఇట్ ఈస్ ఫర్ ఫాస్టర్ జెనెటిక్ ఇంప్రూవ్మెంట్, ఇప్పుడే చెప్పుకున్నాం. ఇంపోర్టెడ్ ఎక్స్పోర్ట్ ఆఫ్ ఎంబ్రియోస్ ఈజ్ ఈజియర్ దాన్ లైవ్ యానిమల్స్. కాబట్టి నాకు ఇక్కడ ఒక జెనెటికల్లీ హై బాగా సుపీరియర్ హైబ్రిడ్ తయారు చేశాను, ఈ యానిమల్ అక్కడ పంపించే కంటే ఎంబ్రియో చిన్న బాక్స్లో పెట్టేసి ఫ్రీజ్ చేసి పంపించడం సులభం. కాబట్టి ఇంపోర్ట్ చేయడానికి, ఎక్స్పోర్ట్ చేయడానికి వేరే కంట్రీస్ కూడా ఇది యూస్ఫుల్ అవుతుంది. సర్కమ్వెన్షన్ ఆఫ్ ఇన్ఫెక్టివిటీ, సో ఇన్ఫెక్టివిటీ కనుక క్యాటిల్లో ఉంటే దాన్ని తగ్గించవచ్చు. సేమ్ ప్రాసెస్ ఇన్ క్యాటిల్ ఆల్సో. కన్జర్వేషన్ ఆఫ్ ఎండేంజర్డ్ స్పీసీస్, ఏవైతే అంతరించిపోతున్నాయో స్టార్టింగ్ చెప్పాను కదా టైగర్, వాటి గురించి, వాటిని కూడా మనం చేయొచ్చు, పాపులేషన్ ఇంక్రీజ్ చేయొచ్చు. అది డ్రాబ్యాక్స్ ఏంటి, సప్లై ఆఫ్ ఎంబ్రియో ఫ్రమ్ సూపర్ ఓవులేటెడ్ డోనర్స్ ఈజ్ లిమిటెడ్. సో మనకి నెంబర్ ఆఫ్ ఎంబ్రియోస్ డెవలప్ అవడం 50 to 60%, అదొక లిమిటేషన్. ఫ్రీజింగ్ అండ్ థాయింగ్ ఆఫ్ ఎంబ్రియోస్ రిక్వైర్స్ లాట్ ఆఫ్ కేర్ టు కీప్ దెమ్ ఫంక్షనల్లీ ఇంటాక్ట్. సో పొరపాటున కరెంట్ పోయిందా, లేదా ఇన్వర్టర్ పనిచేయట్లేదా, జనరేటర్ పనిచేయట్లేదా, అప్పుడు ఏమవుతుంది, ఏదైనా దెబ్బతినచ్చు, ఇదంతా ప్రాసెస్ అంతా వేస్ట్ అయిపోతుంది. 6 నెలలు ఫ్రీజ్ చేశాడు, లేదా 1 రోజు ఫ్రీజ్ చేశాడు, తర్వాత ఉపయోగం లేకుండా పోతుంది. సో దీనికి ఏం కావాలి, టెక్నికల్ స్కిల్ ఉన్న వాళ్ళు కావాలి, అంత టెక్నికల్ స్కిల్ వాళ్ళని డబ్బులు ఇచ్చి బాగా కొనుక్కోవాలి. అండ్ ఫైనల్లీ కమింగ్ టు ది ఎండ్ ఆఫ్ this is done. This one of the applications of embryo transfer is embryo cloning, artificial twinning, or embryo splitting. So what is clone? We already చెప్పాను, clone అంటే same genetically similar copy is called as clone. Production of exact genetic replica copies is called as clone. సో ఈ ఆవు నుంచి సేమ్ అలాంటి ఆవుల్ని శామ్యుల్ నుంచి అలాంటి వాళ్ళు తయారు చేస్తాం అనుకోండి, మార్పు చేర్పు లేకుండా, ఇలా రోజు సాయంత్రం 6 గంటలకు 7 గంటలకు కూడా క్లాస్ పెట్టేవాడిని. సో అప్పుడు ఏం చేస్తారు, దాన్ని ఎగ్జాక్ట్ కాపీ క్లోన్ అని చెప్పేసి అని అంటారు. సో స్టెప్స్ ఆఫ్ ఎంబ్రియో క్లోనింగ్ వచ్చేసరికి ఎంబ్రియో కలెక్షన్ ఫ్రమ్ ద డోనర్ కౌ, బ్రేకింగ్ అప్ ద ఎంబ్రియో ఇంటూ గ్రూప్ సెల్స్. చూడండి, ఎంబ్రియో కలెక్ట్ చేశాడు, కలెక్ట్ చేసిన తర్వాత ఎంబ్రియో ఏం చేశాడు, చిన్న చిన్న గ్రూప్స్ కింద డివైడ్ చేసేసాడు. ఇంప్లాంటేషన్ ఆఫ్ ది యూట్రస్ ఆఫ్ ద ఫాస్టర్ మదర్, తర్వాత వీటిని ఫాస్టర్ మదర్ ఇంట్రొడ్యూస్ చేశారు. ఇక్కడ ఏం తెలుసుకోవాలి మీరు, ఈ సెల్స్ అన్నిటికీ ఇంకా వీటి ఫేట్ డిసైడ్ అవ్వాలి. కాబట్టి ఈ 2 సెల్స్ వీకేస్తే హార్ట్ డెవలప్ అవును, ఈ 2 సెల్స్ పీకిస్తే ఎంబ్రియో డెవలప్ అవుతుంది, బ్రెయిన్ డెవలప్ అవుతుందో లేదు, అంతా ఉన్నా సరే డెవలప్ అయిపోతుంది, లేదా కొన్ని సెల్ స్టేజ్లో కూడా డెవలప్ అయిపోతుంది. అంటే ఇది మళ్ళీ ఎంబ్రియో ఫామ్ చేయగలదు అనమాట ఈ సెల్స్. దానివల్ల ఏమవుతుంది, ఎంబ్రియోని క్లోన్ చేశాను, ఒకే ఒక ఎంబ్రియోని తయారు చేశాను, ఆ ఎంబ్రియో నుంచి సెల్స్ని సపరేట్ చేసి మల్టిపుల్ ఎంబ్రియోస్ని తయారు చేసుకున్నాను. దాన్ని ఎంబ్రియో క్లోనింగ్ అని చెప్తాను. ఒక ఎంబ్రియోని తయారు చేసి దాని నుంచి మల్టిపుల్ ఎంబ్రియోస్ తయారు చేసి ఇప్పుడు సేమ్ ఎంబ్రియో ఒక కాపీనే ఇవన్నీ. దానివల్ల నీకు జెనెటికల్లీ ఐడెంటికల్ క్లోన్స్ అంటే ఆల్మోస్ట్ ట్విన్స్ అంటే ఇద్దరే కదా, ఇవి 100 వచ్చేస్తాయి ఒకేసారి. సో 100 ఒకే రకంగా ఉన్నటువంటి వాటిని జెనెటికల్గా ఒకే రకమైన వాటిని ప్రొడ్యూస్ చేసే టెక్నాలజీ. సో ఈ ప్రాసెస్ మనం ఏం చేస్తున్నాం, ఒక ఎంబ్రియోని తీసుకొని ఎంబ్రియోని స్ప్లిట్ చేసి ఆ స్ప్లిట్ చేసిన దాన్ని సర్రగేట్ మదర్లోకి ఫాస్టర్ మదర్లోకి ఇంట్రడ్యూస్ చేసి డెవలప్ చేసి బేబీస్ని పుట్టించేసాం. ఇవన్నీ ఎలా ఉంటాయి, క్లోన్స్. సో దిస్ ఇస్ హౌ the certain problems of the human beings are said to be what we call addressed.